there's Hoang with Hand Therapy Secrets. Thank you for coming on. And if you are an occupational therapist, physical therapist, wanting to develop your skills in hand therapy, you are in the right place. So I'm really excited today to introduce you to one of my students in the Hand Therapy Mentorship. Her name is Dawn Bean. She's going to share with you her story of getting into hand therapy and the specialty of being a certified lymphedema specialist. So I get a lot of questions about lymphedema and does that specialty kind of fit in with being a certified hand therapist? I think it does. I think there's so much that we can learn. So I hope that you can be inspired by her story of her journey in hand therapy as an occupational therapist in hand therapy and her decision to become a certified lymphedema specialist. And outside of being inspired, I want to teach you, share with you other clinicians that are going to teach you skills that you can use right away in your practice, right? So I hope you enjoy the show. And if you are an occupational therapist or a physical therapist looking to develop your skills and grow your confidence in hand therapy, well, I'm going to include the link for the Hand Therapy Mentorship program for you. So if you want to get details about that, you can always click on that link and request some details and join me every Thursday for a live call alongside with some membership types of videos as well as part of the program. All right, enjoy the show. Welcome to the Hoang Show. My name is Hoang, and today I have a special guest. Her name is Dawn. She is an occupational therapist, and I'm going to have her tell you more about her story and her journey in the hand therapy world. You know that I have this show on specifically to help inspire other therapists to know that it's very possible that they can get into hand therapy, as well as share some useful tips and skills that you can use right away. So Dawn, welcome so much to this show. I'm so excited to have you here. Tell everyone a little bit more about what you do and your specialty.
Sure. Well, thank you for having me. So I'm an occupational therapist. I work in a private outpatient clinic. I work mainly with hands, and I have a subspecialty of lymphedema. So I also treat some of those patients in the clinic as well. I started out as a COTA, and I graduated in 2013 as a COTA. And when I was trying to get into COTA school, I observed a hand therapist as part of my observation hours, and I saw them make a splint, and I was like, that's what I want to do.
That's so funny.
So it's been a long journey. I didn't realize at the time that, you know, I had to be an OT in order to be a CHT. So I went ahead and I finished COTA school, and I got a job after a contracts in Texas. But
what did you do as a COTA? Because I love to hear other therapist journeys, because there's several CHTs or soon to be CHTs that were COTAs before, that were OT assistants before, and they have this question very specifically about, can they become certified hand therapists? And the answer is, you can be a hand therapist, you can work in hands, specialize in hands, but you can't sit for those certified hand therapy exam just because it requires a lot of evaluations. And COTAs are amazing, but one of the things that they're limited by is the fact that they can't do evaluations. But you saw that as a COTA and said, I want to do that. What did you do as a COTA when you first came out then?
So, well, at first I got a job working with kids on the border of Mexico, basically. And I worked there for a little while until this job came up in this hand clinic that I had done a rotation in.
Okay.
So I knew I really wanted to work there. So I just waited until they had a job opening.
Okay.
And about 3 weeks before my contract was up, the owner of the clinic called and he said, I've got a job and I want you to take it. And I said, you don't give that job to anybody else. I'll be there in 3 weeks. Do not give that job to anybody else. So I started there, and I was alone a lot of the time. They had an OT that would come in and do some evals and do my supervision visits. But I just immersed myself in hand therapy, and I studied and I got more educated, and I knew that I wanted to get my CHT. So then I started applying to Belmont University, which has a bridge program from COTA to OT.
That's in Texas. I mean, that's in Tennessee.
It is.
Right?
It's about 4 hours from my house, so it wasn't too bad. So I got in and I graduated with my OT degree in 2018. So then
congratulations. That was like so recent. Good for you.
Thank you. It was hard. I mean, I worked full time and I was in a master's program full time. But
incredible.
I did it.
You did it.
Yes. I knew what I wanted to do, you know,
Yeah.
and when you're sure of what you want to do, then it's easy, you know, to go through the steps. It's easy to keep yourself motivated.
I was going to say, it's easy to keep yourself motivated and focused, you know, because you see the light at the end of the tunnel. I think one of the hardest things about hand therapy, or for people who are trying to get in, is they don't see the light at the end of the tunnel. Like they never see themselves as being a hand therapist. So then they never take the classes that they need. They never, it's hard to just study on your own. I mean, we go to school our whole lives and we're held accountable every step of the way, from grade school to middle school to high school. And then you get to college and you're held accountable there too. But somehow when you come out, you're like, okay, I'm done.
Yes.
And you're not held accountable anymore, and unless you want to be held accountable, right? So
you got to be motivated. You got to know what you want. You got to just stay focused and set a timeline. Like I knew it was going to take me 2 years to finish the master's. And then I knew it was going to be 3 years before I could sit for the CHT. So here I am, I've got another year left before I'm eligible to sit for the CHT. But I've known this whole time, I took a year off from studying because I was like, I'm done.
we all need breaks, right? It's kind of like your sabbatical. It's kind of like your sabbatical. I actually was listening to something just this morning about taking sabbaticals, like every 5 to 7 years or something like that. You're kind of like taking that little sabbatical, depending on how long. You took a year, some people take a couple months, but you took that sabbatical to like give your brain a break. But you knew you also had a goal. You saw the light at the end of the tunnel in terms of, you know, working towards being in hand therapy. So tell us a little bit more about your subspecialty, because I get questions about lymphedema a lot, and I've seen therapists move into lymphedema as a way of getting into hand therapy, because there's a lot of people with lymphedema needs that their arms are affected.
Sure. So the whole lymphedema specialty came up. My clinic was really looking for someone who would go and get certified. They wanted to be able to offer that. We got calls from, you know, referral sources wanting to get people in, and we just didn't have a specialist in the clinic. So I thought, well, I'll go do it. I don't mind. I'm not, you know, I'm just hanging out till I can go get my CHT right now. Like, why not have another certification? Let's get all of the certifications. You know?
Hey man, I'm with you.
I mean, why not, you know, go and make yourself as smart as you possibly can, and because there's somebody out there that needs your help.
Yeah.
I went and I did all that training, and now I have you know, my CLT. So get all the letters behind my name, you know, before I'm all done with it.
Yeah.
But it's really, I mean, hand therapy is the main thing that I do in the clinic.
Right.
We're a really busy hand clinic. I've talked to you about this before. You know, there's teens of patients coming in, 16, 17, 8, sometimes 24, you know, but I do have some blocks for lymphedema patients, and it's roughly about 5 to 10% of my patients are lymphedema patients.
Okay. That's great though. It makes you're very, you know, what I tell people, you're very marketable.
Yeah.
You're very marketable when you develop skills, right? So sometimes when you were like, oh, like I don't want to develop skills just because, you know, it takes too much time and too much effort. But then you really do kind of hold yourself back from getting those opportunities where you can help more and more people. Can you tell everyone who's watching the process of getting certified in lymphedema?
Sure. So there's a couple of different schools that offer their certification. I went to the Norton School for Lymphatics.
Okay.
It was great. I thought it was perfect for me. There's an at-home study course, about I think it's 45 hours that you have to do of studying and taking online quizzes before you go to the lab course, and that is for 10 days. The lab courses, and you are literally in there practicing the MLD treatment, the manual lymph drainage, and the wrapping. You're doing it for 10 hours a day for 10 days. So it's really intense. You have to take a written exam, you have to demonstrate your skills, and you have to present on a case study at the end. And it's no nonsense, you know, it's not like, oh, we're going to give you a certification no matter what.
Right.
They are
Yeah.
very serious about
Yeah.
it.
Yeah.
So,
Most certifications are you take a 3-day class, you sign your name, you know.
yeah.
And you know, being a certified hand therapist is not like that. Being a lymphedema specialist is not, certified lymphedema specialist is not like that. Can COTAs become certified lymphedema therapists?
They can. They can.
Okay.
I had PTs, OTs, COTAs, PTAs, and massage therapists.
Yes.
Mhm.
Very nice. That's awesome. See, so there are specialties. Now, lymphedema, when I worked in a hospital, I worked with a lymphedema specialist, and she worked the whole body, legs, arms, everything. Do you do that as well?
I do.
Okay, good.
The manual lymph drainage part of it, the massage, we hate to call it that,
Yeah,
but
we all,
but that's what everybody thinks it is.
it's what people know. So
That's
when
true.
people ask me about that, I just had a lady yesterday, and she's like, oh, well, you do the massaging part. And I said, well, what we do feels like a massage, but it's a lot more technical in terms of releasing certain tissues or helping you to move better, right? So it feels like it, but there's more purpose to it than just going to get a Swedish massage at a spa, which we all love to do.
Sure.
But those are more relaxing that we should enjoy, but this is more specific. That's how I usually describe it. So what you do is very specific, the lymphatic drainage.
Yeah, and I do the whole body. There are pumps out there too that that you can use, but there is absolutely nothing that can replace the actual MLD.
That's right. Yeah. That's what I tell people all the time. Now, let me ask you real quick. Do they teach you or do they talk about lymphatic drainage massage for weight loss? Because I never knew that. And so one of my past patients, her and I became friends and whatever. And she came to Miami not only to visit, she comes in once a year and she comes here for therapy, but she was looking for a lymphatic drainage massage for weight loss. And I was like, girl, like I had no idea. So I looked for that.
Yeah.
And it's a thing.
Yeah, so you're moving a lot of fluid. I mean, if you think about it, like you could be carrying excess fluid on your body, and it's
I am. Can you I'm like, how can I lose this 5 pounds? I'm just draining some fluids.
I'll catch a flight down to Miami and we'll just MLD each other.
Please.
So, like, funny thing, and this might be a little bit too much TMI, but so when I was at the course, me and one of my other fellow therapists she worked somewhere else, but we went together, and so we shared a hotel room, and we would do the MLD twice a day and wrap twice a day on each other. And girl, we would be waking up in the middle of the night, like go into the bathroom, but and it would just be flowing out.
Like a waterfall.
Yes.
It's like Niagara Falls. It's going.
It was. And every time they would give us multiple bathroom breaks too at the course, because they were like, we know all y'all got to go. So, it's time to go again because you're pushing so much fluid.
But it's incredible. Like, really, when you think about people who have chronic issues, we get people who have CRPS, like chronic types of hand issues, chronic types of tendonitis. As you know, I just went into this conversation yesterday, but there is a lot of impact from our lymphatic system to the rest of our body. And when I talk about skin and fascia and muscles and tissues, that has a huge role in how you feel,
Everywhere that there's skin, there's a lymphatic system right underneath it. So it's just as big as your integumentary system.
Right. No, it's incredible. So I think that's why I was, when I heard that you were a certified lymphatic therapist, I was like, I need to talk to you, because I think it's such a great specialty that really pairs well with hand therapy, or if you decide to specialize in anything else as therapists. I think it really helps us, and it can help us in any setting.
It
really can. It can help you in an outpatient setting. You could be in a hospital outpatient setting, or a hospital acute, rehab, skilled nursing. Like, we all have fluid.
Yes.
We need to get rid of it. That's so awesome. Tell me a little bit more about how you would recommend. I think we had a question from the Hand Therapy Mentorship program, and there was a specific question because in the hand therapy, so before I carry on, you're in the Hand Therapy Mentorship program, and I asked all the students that were in there, because we have students in there who work in outpatient, we have some people who work in acute care and skilled nursing, and they're all looking to improve their skills and become the specialized hand therapist in their area, right? So she currently works in a skilled nursing facility, and I am a huge advocate of therapists who work in all settings to really know about the hand, elbow, and shoulder, because if we're lucky, those people have hands and arms, and they all need help, right? And so she had a very specific question about lymphedema, because she does lymphedema too. Do you remember the question?
Yeah, so she mentioned that the facility where she works doesn't allow them to use short stretch bandages. So short stretch bandages they appear just like ACE bandages, but they are all cotton, 100% cotton. And that's important because you don't want any elastic in those bandages. And that's a whole nother conversation we can go into. But the elastic is very dangerous for someone who has lymphedema. It could cause a lot of problems. So she didn't say that they wanted them to use elastic bandages, but specifically that they couldn't use short stretch bandages. So just to answer her question, first, you've got to advocate for those patients, and you've got to educate, the higher ups, the supervisors, the board, whoever you need to, on what's going to happen if you don't provide treatment to these patients. Their health is going to decline dramatically. There's going to be so many other medical conditions. They're going to be at risk for cellulitis and venous insufficiency, elephantitis if this is not treated. So there's other options though.
So the education should actually be, what is short stretch bandage? How is it different? Mm-hmm. What are the benefits of that? Mm-hmm. And the consequences of not using the appropriate tools.
Correct.
Right. So it's always about that. You have to assume, or you have to go into, when you're advocating for occupational therapy, or anyone who wants to do something different from what is done, the advocation always starts with talking to that person I think it comes down to talking to them very basically and saying, like, what is this? What is short stretch bandage? How is that different? how does that help? What are the consequences? And the consequences is huge.
They
That's
are
very
huge.
important.
And it all comes down to taking care of that person. You know,
Yeah.
that's what we're all in this for, is to help people. So we've got to find ways, you know, to convince others to get on our team.
And I would also add, you know, as someone who now owns their own practice, I never understood the financial aspects of it when I was working for someone else. I completely understand the financial aspects of it now, working for myself. And I think that there's a key determining factor when you talk about the consequences. How do you tie it back to what's important to the person you're talking to, right? So the person you're talking to is probably not just resistant to the specialty or what has to be done. They're concerned about money.
Right.
So what's the cost as compared to the other thing? Is there a huge cost?
Well, sure. So I was going to also mention that there are other options besides the short stretch bandages as well that she could go in, you know, and use as a bargaining tool as well. So there are companies who make Velcro wraps, which actually mimic short stretch bandages. They're made of a neoprene type material. But really, the cost is about the same, because I keep the short stretch bandages in my clinic, and then I also can get the Velcro wraps from a local company, and it costs about the same, but she might run into difficulties with the nursing staff being able to apply the short stretch bandages, because that gets really complicated. I mean, I went to 10-day training on how to wrap, and teaching a nurse in 20 minutes how to do it it's impossible.
Yeah.
So the Velcro wraps, though, are way easy. And, you know, I teach all my patients how to use those Velcro wraps, the ones that choose to go that route.
So if the cost is the same, then it's about the ease of someone else carrying it out in that particular setting, which might appeal to the higher ups, right?
Yes.
And also the consequences. You said, what were the consequences usually in a, like, do they stay longer in a rehab, or do they, what are some of the consequences, I think?
So if you don't manage lymphedema, then it's going to continue to get worse. These folks have to be in compression 23 hours a day for the rest of their life.
Really?
Every moment that they're out of compression, it allows the fluid to build back up into that limb or area. It might be their torso, it might be their face, where they have lymphedema. So they have to be in compression. And when they're not, it's spilling over into their interstitium. You know, their limb is getting larger and larger. It can actually start to weep out of the limb. I've seen that before. It's so big that your skin is weeping lymphatic fluid. You can develop sores from that. You're at risk for cellulitis, which we all know could be life-threatening. You know, it affects the venous system, and it can overload the heart. I mean,
So, but in a skilled nursing facility or a rehab setting, do they know, like, that person has lymphedema versus they're just overall like keeping drainage in their body?
Yeah, so are you talking about like if they have lymphedema or just edema?
Yeah.
So it takes either a skilled CLT to notice whether or not it's lymphedema or not, or a physician who's, you know, trained and educated in it to give that diagnosis. A lot of times we can go by history, medical history. It'll tell us the story on why that person got to where they are today. You can have a lymphedema diagnosis, but you can also treat edema the same way as lymphedema. So you would need to know about that person, whether or not they had the lymphedema, if they were going to have to need long-term management of it. So that would take some extra steps.
Well, that's really neat. So what is one particular skill that you could teach someone who's watching this right now manage a hand patient that has edema, but not necessarily lymphedema? Because like you said, lymphedema is like very much a specialty. But since you work in hands and you have extensive knowledge on lymphedema and how that lymphatic system works, what do you do specifically for your patients that come in and they're like tons of swelling?
Yeah. So the first piece of advice that I have for that is prep the lymph nodes. So if it's a hand, so the lymph nodes are going to be in the axillary region, in your armpit,
Your armpit.
right here.
Okay.
So if you're wanting to pull fluid distally to proximally, so you're just going to place your hand on your arm here, and you're going to pull towards the armpit.
Okay.
And it's not a glide, but it's actually you're pulling the skin.
So
and
it's like moderate amount of pressure. I always compare it to, it's not light like you're putting on lotion, and you shouldn't
Right.
see whiteness like your indentations and anything. So it's a moderate amount of pressure. You're
I would say
trying to,
mid to mod. Yeah.
yeah.
You're just pulling the skin towards those lymph nodes. And this is what's super important right here. Okay. So you don't want to just take your hand away. Whoops. Can you hear me?
No, I'm telling everyone to listen, listen to Dawn. She said, this is very important.
This is very important. So you're moving the fluid here. If you just move your hand off, the skin recoils back, and all that fluid that you just moved just goes right back to where it came from. Okay. So this is a special part of it. So you're going to move the skin towards the armpit, and then you're going to relax your hand, but you're still holding on to the skin, and it just helps guide the skin back into place, but all the fluid's still coming. Okay.
That is very much like moving a joint.
Yeah.
Right? When you crank on a joint and then you just let go.
Oh, it's like squatting.
Yeah.
And then that's what I always say. Like, okay, I'm going to let go slowly, because I know what my knees feel like when I've been squatting for a minute.
Yes.
Yeah.
One of the things that I do is if I'm cranking out someone and doing a prolonged stretch, instead of just letting it go, not only do I let it go slowly, but I have them work against me. And it takes the bite out of the pain of going back out. Because so that's why I'm sharing it. You sharing something, I'm sharing something, so everyone can get a little bit more all the time. But yeah, I do that, especially in a hand, especially in the fingers. It's very painful, and the pain in a joint problem is a sharpness. There's a sharpness to the pain, unlike sometimes in a bigger joint per se. But when they have a very particular type of joint stiffness, especially the PIP, if I'm pressing down and I'm stretching them out, not only do I let go slowly, but I'll tell them push up against me, push, 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 push. And then I'll give them just a slight pressure while they're pushing up against me. And it helps to ease the bite of the pain, like the sharpness of the pain. And I also, like with PIP, as they go into extension, if you manage their MP, MP flexion assists with PIP extension. So when they're coming out into extension, I'll go into a little bit of MP flexion to kind of move into that like normal pattern of movement. So that description that you just gave me just made me think about how a lot of things, there's a lot of similarities really at the end of the day. So if you're just pulling and pulling and then you let go, it's going to recoil. How long do you kind of wait? I think a lot of people would have that kind of question. If you pull the skin back, how long would you be waiting?
Really none. So you only need about 5 to 7 strokes too.
Okay.
So you're going to pull, relax, pull,
More.
relax.
Okay.
And that's it. And so it takes just seconds to do this.
And then what are you looking for though, distally?
So you're not going to see anything distally, but what you've actually done is you've woken up the lymph nodes there. So they're going to accept that fluid. They're going to purify it. They're going to filter it. And they're like, oh, something's coming my way. Oh, here we go. I'm thirsty, you know?
Okay.
And so, and especially with hand patients, because they all stay like this a lot.
Mhm.
And so they're
Compressing it
yeah,
and not
yeah.
open to
We
receiving.
need to open it up. Yeah.
So I asked that question because I think it's extremely important to explain to our patients not every exact thing that we're doing, but there are certain things that we want to encourage them to be able to do. Is this something that they can do as well?
Absolutely.
Okay.
It takes, you know, some folks never truly get the, you know, like pull and release part.
Yeah.
But a lot of people do.
A lot of people do, or at least just to have them understand that it's okay, it's safe to move their arm away from their body.
Yes.
Right? But when you explain it, sometimes you explain that this is a process, you know, because a lot of people see their hand swelling. They're like, what are you going to do right now to get rid of it? And there's a certain mental thing, which is, I want it to be gone now. I needed it to be gone yesterday. I didn't even want this shit to start with.
Right.
So, so it eases our frustration as therapists, but it also eases their frustration as someone going through an injury to say, you know, if we help here, we'll help here, and you'll see it over a flow of time, over a fluid of time. Usually when I work with hand patients versus patients, elbow patients, there's always a play on the shoulder. So it's very important to like kind of explain that to them too, so they understand their compensations, their movements. And a lot of times when you're explaining the why behind something, it really helps someone to like buy into what you're doing as a specialist that's trying to help them recover. So Dawn's in my hand therapy mentorship program. And how did you find me, by the way?
So Facebook. Um, I'm the only OT in my clinic. So I I need other OTs to help me, right?
Yes.
So I follow as many pages as I can. I'm on YouTube watching videos. And so I ran across your mentorship program, and I knew that I needed some guidance and to help me get ready to sit for this exam, trying to figure out, you know, a timeline and a strategy to study for the exam is overwhelming. And so I knew that, you know, you were out there and you were helping other therapists. And I thought, this is, you know, what am I waiting for?
Yeah.
I know what I
What
want.
are you waiting for, everyone who's watching?
Right, right.
You know, I was gonna ask, was there one thing that spoke to you very specifically? Because I get a lot of people who tell me they're gonna wait. They're gonna wait for some magical moment to happen. They're gonna wait for that job, or they're gonna wait for, I'm like, what are you waiting for? Because the more that you wait, or the more that you're just going to a certain extent, you're getting the free stuff, right? Like, so I'm a huge fan of putting out a lot of free content, like showing you how I work in my clinic, because I want people to see the possibility. I want to show them there is a light at the end of the tunnel, that they can have what they want. That's one of the reasons why I show it. But what was it that spoke to you very specifically? Do you remember?
Well, really, it was, I got to sit in on one of your calls before I signed up. So you sent me a link, and I participated in the call on that Thursday night. And I was like, yeah, I need to be doing this more than once a week, but I'll take once a week, you know? And then it gives me things to go back and, like, you gave treatment ideas that I could go back and apply the very next day to my patients. And you helped me understand things more deeply. So, you know, the cost of it is like, well, how much is it worth to you, you know, to get what you want? And it was worth it to me.
Okay, good. I'm glad it's worth it. That's what I want. I don't take people's time and money lightly. So that's one of the reasons why I do free calls, or I have people book calls with me to talk to me first, because I want to make sure they're going into the right programs. So that's awesome. So I'm excited to see your journey. You for sure, next year, 2021.
Yes.
Yes, it's going to be there. And I think one of the things, the reasons why I put out the stuff that I put out is to show that other people are doing it, so that people who are wondering if it's possible for them, that they can see that there are other people doing it. So I actually have several people in the program who are planning on taking the CHT, whether soon or later, but they're coming in on the Thursday calls to get that accountability, to get that focus, and then to get a faster direction, basically, so that they're not wasting a lot of time,
Yeah. It takes a lot to want to be a hand therapist. I mean, there's a lot of information, and the more you submerge yourself in that environment, the better therapist you're going to be, first of all. But you always also can become a part of this network of awesome therapists who are always at your disposal just to call and bounce ideas off of, especially someone like me who's in a clinic by myself. I mean, I have a few hand CHT friends that I can call. But then, why not have friends who are all over the country too? Because we all see different things.
We all see different things. We have different ideas about stuff, and it's great to be different, but it's also it's good to have a understanding of why you're doing what you're doing. So as part of the mentorship or any of the programs that people are in, you have access to the Facebook group. Like, I have a very private, small Facebook group, and so you're pretty much there with other people who are dedicated, who are committed like you are, so would you say that that's different from like maybe a bigger one that's just very generalized? Like,
yeah, I would, because we're all talking like on the same topics as well. So we're all on the same calls, or we're all kind of familiar with each other and cases that we've been seeing. And for the videos that go up in the Facebook group, girl, I'm a busy person. So when I get in the car, I turn on your videos, and I just listen to them like a podcast, because I'm going to miss something if I don't watch those videos or listen to those videos. So
yeah, I have videos, and I think it's so much more than just skills, right? So it's one of the things that I advocate. It's how we speak to the people that we work with, whether it's our clients, or whether it's our bosses, like, just speaking to your directors, your supervisors in a certain way. It's going to help you become more, it's going to help you get what you want.
Right. Right.
I mean, like, I'm just gonna put it like that. It's gonna help you get what you want, right? So you speak to a patient a certain way, it's gonna get you what you want, which is their buy-in, their commitment to you, them wanting to come back to you, those kind of things. So when we're able to help other people, then that's where we get, that's where we get our fulfillment. That's where we get the career that we want to build. Have you been in the same clinic for a while since you graduated?
Yeah, so I did a rotation there, and so you can say it's been 7 years if you count the rotation. I just had like a little 6-month leave.
Okay.
So I've been at the same place, and I actually travel between 2 clinics. We have another smaller clinic just about 11 miles up the road, so I go up there 2 afternoons a week.
Yeah, a lot of people have a hard time getting in, and I think it's very possible still there was something you did. They waited 3 weeks for you. I mean, I take students all the time. I'm not hiring everybody. Like, first of all, I don't have the space or the whatever in clinicians, but and not everyone wants my job. Not everyone thinks that they want to work with me, but they really don't. You're better off paying for a mentorship. But there's something that you did in your internship that made them want to call you, because I'm sure that they had other students. What do you think that one thing was?
I'm real confident in myself, and I present myself with confidence. They also call me drill sergeant over there, so I'm very no nonsense. You know,
Yes.
it's black and white with a sprinkle of gray
Yeah.
with me, and I've worked my entire life, so I know what, you know, what it's like, what they need in professional skills. And I think I came in there as a professional, and they saw that, you know, I was confident and I had goals and I knew
Yeah.
what I wanted to do, and so they were willing to wait for me.
You probably proved that you were going to do what you said you were going to do.
Yeah.
That's a big thing that I think people miss out on. You say you want something, but are you actually doing it? You know, people want to get into hand therapy, but what are you doing to actually get into it? So there was you did it. You're a confident person, and I'm sure you're able to show that. But I think the other aspect, and it's something that I always look for when I'm hiring, you said you wanted something. What did you do to get that? You might not have gotten it yet, but you're taking those small steps to get it. I think that's the biggest difference between someone who gets into that hand therapy position versus someone who doesn't get that hand therapy position and then say like, it's so hard, it's impossible.
Mm-hmm.
Yeah.
It's not impossible. I mean, put yourself out there. I mean, align yourself with the therapists that work in that clinic already. You know, reach out to them, bug the crap out of them. You know, call
Yeah.
them. Hey,
Persistence.
you know, I know. Yeah.
Persistence. It's you're not bothering them. People think they're bothering me all the time. They're not bothering me. Just
No,
I mean,
make them want
busy,
you.
right? Yeah.
Even if that's going to get a CLT, you know, in the meantime, and say, well, hey, if you hired me, then I could see the lymphedema people in your clinic too. You know, like you were
Smart
saying,
move, Dawn.
make yourself marketable.
Yeah, and I think you open the doors. I always talk about, you know, when you become a certified hand therapist or when you get that specialty, you really make yourself that much more marketable. You not only have options, but you have choices. Options are for everybody. Like free is for everybody, right? Free, you know, like everyone can, but only a few people will have choices, and it's because of the actions that they took to make sure that they have those choices. And, you know, getting your certified hand therapy, you know, will be that. So I'm excited.
Yeah, and you can take those certifications and go anywhere with them. And that was a thing that, you know, decided or made me decide that I wanted to go ahead and do the CLT was, hey, if I ever move to Texas, then it'll be a lot easier for me to get a job because I have this extra certification.
Yes, it does. People want that. People want that specialty. You know, kudos to you. I think it's awesome. I love it. I'm looking forward to, you know, learning more about lymphedema. We'll just share. I do spine. Yes. You do.
Yeah.
You do lymphedema, and we're gonna kill it.
Yeah. It's gonna be a double threat.
Awesome. Thank you so much. Did you have any questions for me?
No, I did not prep any questions for you. I was prepping for my own questions.
Well, you have me every Thursday. You have
right.
me in the private Facebook group, and you have me via email. So you don't have to ask questions here. You can ask them anytime you want. And all the viewers, you guys, I hope you enjoyed this. And there are some great tidbits in there to inspire you, to give you skills, and also to let you know what is possible for you to be able to do to get into hand therapy and to specialize in your neck of the woods. Thank you so much for watching, and I'll see you next week.